transforming Africa's healthcare from small-scale trials into continent-wide realities. That was the central mission in Abuja, Nigeria, as the 6th Africa Digital Health Summit concluded at the Abuja Continental Hotel. Gathering global health leaders, policymakers, and tech innovators, this year's summit tackled a critical hurdle. From pilots to scale, growing Africa's health innovation ecosystem. The financial stakes of the digital shift are massive. Nigeria's Ministry of Health revealed the country requires a staggering 500 billion naira over the next 5 years. This funding is critical to construct the foundational digital infrastructure for its national digital health architecture. To meet this goal, the Minister of State for Health and Social Welfare made a bold call to action. He urged pension fund administrators to invest heavily in digital health infrastructure, highlighting it as a unique opportunity to boost health delivery. While
health is actually life, and we need to stop treating health like a subset. Climate is health, nutrition is health, health is life. So I would say that we all need to understand that we need to all put our skin in the game. We need to all share the investment and also share the responsibility of making health work. And that also has to do with trust. It's also a conversation around trust. We need to trust each other. We need to understand that there is complementarity. When we trust each other, we're able to bring down our guards, and we're able to know that one organization cannot do it alone, and really be more considerate, and very importantly, redefine the metrics that we use in terms of the indicators around health outcomes. Less of only focusing on delivery indicators, but a lot on focusing on sustainability indicators.
Throughout the two-day event, session partakers like eHealth Africa and SIDA drove intense policy debates. Industry experts stressed that technology alone isn't a silver bullet. True progress requires unwavering government leadership, strict data privacy, and a shift away from temporary donor-supported projects towards more self-sustaining financial models.
So ADHS actually, it's a convener of, or a platform that gives rooms for different digital health conversations to hold. And this year, what was very important, which is something very significant, is the involvement of the federal government, right, at ADHS. And that really gave room for a lot of conversations that could be taken forward by the national government in terms of expanding its digital health initiative. And from the ADHS in itself, we could see that government had several, side sessions where they are discussing policy direction, and new policy framework that they need partners, buy-in.
Cutting-edge AI diagnostics for climate health financing and universal health coverage, the roadmap drawn in Nigeria, Abuja, is clear. Africa is ready to move past the testing phase and fully scale the future of medicine.
Glaucoma, often described as a silent thief of sight, remains one of the leading causes of irreversible blindness globally and in Nigeria. Health experts estimate that millions of Nigerians are living with this condition, many of whom are unaware of their condition due to its slow and painless progression. The chairman of the FCT chapter of Nigerian Optometric Association says early detection through regular eye checks is critical to preventing vision loss, hence the need for this outreach.
Traditional eye medications have been shown to cause more harm than good. Why that is so is that tests are not done, diagnoses are not made. It's usually one drug cures all. So my advice is, when you can, always seek medical advice before you use any medication. Do not put anything into your eye that has not been prescribed by an optometrist or an ophthalmologist. It is very important you do so.
The outreach program held at the Palace of the Chief of Garki provided free eye screening and consultations for residents, especially the less privileged.
We want to encourage that continue with this humanitarian gesture. And I also want to use this opportunity to draw the attention of other Nigerians, international bodies, to come into our aid. The government cannot do everything alone.
Being blind is not something anybody pray for. So in due course, we want to watch what we eat, we want to watch how we behave as well. Our lifestyle is very important. Eyeglasses are now expensive. Can the government look at it and give the people the citizen a reduced price for all these things.
Beneficiaries of the outreach expressed appreciation, noting that the free screening helped them better understand their eye health status.
You've probably seen colored wristbands on patients in hospitals, but they are more than just identification tags. Many hospitals use colored-coded wristbands to alert healthcare workers to important information. For example, red often indicates an allergy, yellow may signal a fall risk, pink can represent limb restrictions, while purple may indicate special resuscitation instructions. These visual cues help staff respond quickly and reduce the risk of errors. However, there is no universal color system, meaning colors can vary from one hospital to another. That's why healthcare workers follow their hospital's specific protocols. A simple wristband can play a big role in keeping patients safe. Yes, we're going to be discussing the topic lupus. As you already know, the month of May was the official month for lupus awareness. However, I don't think 1 month is enough for this conversation. It should be something we discuss every single day. Now, I'm not going to be discussing this issue myself. I have two of the most amazing women in the world to discuss this with me from the lupus community, and I'll allow the queens represent and introduce their crowns. Thank you so much for joining us today on Health Digest. So let's get straight to the issues at hand. Before we get to the model that you have pioneered, for those of us that do not understand what lupus is, could you give us some sort of introduction? What is lupus to you and in your experience, because I know it varies to many people?
So lupus is a chronic health condition. It's an autoimmune disease. It practically appears in the form that where your immune system, which is meant to protect your body, your organs, your joints, starts to attack the very same body that it's meant to protect. So in a sense, it feels like a malfunction. Your immune system gets confused. What am I protecting? So instead of protecting those organs or joints or whatever that is in your body, it starts to attack the same thing. And it's the same things it's meant to protect. So it works against it. So that's what lupus is. It's a chronic health condition, autoimmune disease, where our immune systems are unable to identify what they're meant to protect and what they're meant to fight against. Rather than fighting against germs and bacteria and diseases, they now fight against us. So that's what lupus is. It does mimic quite a lot of illnesses. That's why we have delayed diagnosis. So symptoms like people coming back and forth with malaria, fever, and stuff like typhoid, while what is really affecting them is lupus. That's why it's a great mimicker of stuff. So just simply put, it's when our immune systems are unable to protect us, it then fights what it's meant to protect, if that explains it.
Thank you. That really breaks it down in a very simple form, because what is done is that it's an autoimmune disease, but then that can be, technical jargons. I'd like to understand, what are some of the causes, and why would you say it varies in different people and probably genders as well?
Yes, it does vary. So in a sense, my study focuses mostly on Black people, because it disproportionately affects Black people more. So it's 3 times more severe in a Black person than in the Caucasian community. And most especially women from childbearing age. So it affects people from science says 15 to 45. But although we've now started seeing that there's early onset of lupus in childhood, it also affects men, not just women. And for every 10 people that lupus affects, a man is included. So 1 out of 10 people will be a man. And for those effects, it's also very severe. So in that sense, Black people, and in our context in Nigeria, have severe issues like organ failures, skin, joints. All the severities of the illness can be exacerbated in us because of our gene disposition. That's basically why it affects us the way it does.
Thank you so much for that again. Like I said, very detailed, very simple to understand. Now, when it comes to the Nigerian healthcare system, do you think it is adequately equipped to cater to the needs of those living with lupus in the country? And if not, what do you think the healthcare system needs to equip itself? I mean, you're speaking from the UK, so let's see what is obtainable and how the standards vary when it comes to lupus treatment over there.
The healthcare system in Nigeria has failed us in more ways than we can explain. So the thing about lupus, it's a lifelong illness, unfortunately. So it's not a kind of illness that you would say I would give a course of antibiotics for 2 weeks or how long that takes. I'll just give that course, and after that, you will be fine. So it's an illness that has to be managed for the rest of the person's life. But our healthcare system is not built for that. Our healthcare system is not even built for temporary issues, talk more of a lifelong issue. So that is a very it's a hard pill to swallow, because, for instance, here in the UK, we are not talking about medications because we will get the medications. For someone with lupus, like the basics, which is like hydroxychloroquine, it is not so basic. So in our country, in Nigeria, what is basic is not so basic. And when people now have organ complications where they now need more major immunosuppressants, say like mycophenolate, cyclophosphamide, we're not even talking of biologics, which when we now go further to belimumab, rituximab, and all that, these medications are very expensive, even like in the UK, but is accessible and you can get it. And if someone needs it, the person can get. These are treatments that you use monthly. Like, for instance, belimumab, you use it monthly. For people that need injections, we'll have the injections weekly. Our healthcare system in Nigeria cannot sustain that. That means that people deteriorate even quicker, and people lose that trust for the medical system because the the National Insurance, NHIS, does not cover that. So for us to be up to, we need testing in Nigeria.
Mm-hmm.
We need to have facilities that are able to test people. We have shortage of rheumatologists. For a country that has more than 20 plus million, 200 million people, over 200 million of our population, we just have barely 43 rheumatologists.
Wow.
And we have how many within the country, while others are in diaspora. So that makes you see that someone like that is somewhere outside of Lagos, Ibadan, or outskirts, can't even get regular checkups. We don't have medication adherence. Why? Because of inflation. So if I buy medication for 10,000, if it's not 10,000 now, but if I buy medication for 10,000 this month, I have no guarantee that medication will be 10,000 next month. I have participants in my study that had to spread their medication so it would last. So tell me how that medication is going to work. If I'm meant to take a medication like hydroxychloroquine that I'm meant to take every day, morning and evening, every day, and I'll now have to spread it out and not take tomorrow or the next day so it will spread out. Tell me how that will work. So there's a fundamental thing that needs to be done in the healthcare system. So I think the government needs to work on establishing a secure health insurance for people with chronic illness. It is not a walk in the park. So in that sense, the illness does not only affect you physically, it affects you mentally because you have a lot to think through. Do I eat or do I take my medication? Those that have organ complications like kidney issues, that need kidney transplant, that need dialysis, it's a lifelong thing. So when they just keep on raising funds, even the people raising funds for them get tired. That's why you see major relapses, because they stop going for those treatments because they lack the funds. So it goes through different layers, affects your identity. You feel like whenever I show up, it's to ask for money. But if we have a system that provides that basic medical needs, there are people that wouldn't even go for testing because they can't afford to get tested. They can't afford to get those tests that they need to prove that they have lupus, or the tests that they need to show where their markers are. So it's a lot of complications that needs to be sorted, but we can't sort it by just talking. We can sort it by equipping our hospitals, having systems that keep our doctors in Nigeria to stay and treat us. The things that my study exposed me to is not just the patients, but also the limitations that the doctors also face.
Yes.
Because when you meet the patient that has a lot of complications, you get limited because you know that they don't even have the financial capacity to take the treatments that you're going to offer them. So it's kind of a very complicated space.
Yes.
That we're constrained a lot in Nigeria.
Thank you so much for that. You've mentioned some very critical points. I mean, if the healthcare system is struggling for basic necessities when it comes to lifelong illnesses, it might be an overload, but I do definitely like the conversation around the area of having special healthcare insurance packages for this. Now, being someone who has seen both sides of the scope, nationally and internationally, what are some of the things that you would say your research has birthed when it comes to the support of people living with this disease?
I think one thing in the course of this in this study, what I've noticed is that despite, I think we can say that Nigerians are very resilient, but despite the uncertainties and the unpredictabilities of our illness, there's something that participants or patients have not lost, and that is hope. But hope is quite expensive, but they're still holding onto it. It's to find that there's means of thriving and flourishing with people with lupus or chronic illness in general. But I think that, just like we said before, the basis of this thriving and flourishing has to do with help with healthcare, the financial support. Just a brief back, when I started this, I was just looking at the psychological aspect of improving people's lives with counseling or psychological interventions. However, in getting into the study, I saw that when the basic is not met, you can't give a psychological intervention because the basic is not met.
Yes.
The physiological needs are not met yet before you now allow people even think of how do I have to survive to think of tomorrow. I have to feed for today to think of tomorrow. And that's a Nigerian story.
So the sustainability is a major concern. So sorry to cut you short, but because of lack of time, I'm very much interested in the conference and the convergence that you have coming up. Tell me about that and how this will proffer solutions to some of the issues that we have looked at when it comes to lupus management, care, and the healthcare system intervention.
So the conference is about bringing people together. So we're working on bringing consultants from England, from the UK rheumatologists, and bringing consultants from Nigeria to come. And then people with lived experience, because this conference will be nothing without the people with lived experience, because they are the voices that needs to be heard. So Researchers can bring insights. Yeah. Doctors can prefer constraint on how their practice works. But if we miss the basic, which are the people with a lived experience, then we have no story to tell. So this conference is to hear their story, to hear what it means to prefer good care. And in essence, merging those research, doctors, people with lived experience together, we're trying to bring a room for collaboration, where charities such as like Mabel V Foundation, which is working in Nigeria, trying to build the research center, can come up with what they've been doing, and people can listen to the stories of people that are members of that group, what they're going through, what this foundation has been doing. And Lupus, like for instance, Lupus UK are also coming for that, so they can hear what other charities are doing over in other countries and find a space if there will be collaboration to see how we can help systems to grow. So it's a room for collaboration. It's not just a room where we can talk and share papers and findings, but can we take those papers and findings into the field and make it make sense to people that need it, and bring it to practicality, that something will be built out of this that helps those people suffering with lupus, if it's like medications, tests, and all that. How do we make that happen? So I think that's my purpose for this conference, where stories are being shared, experiences, research, but most especially the voices of those who are in the thick of it, and these are the patients.
I think this is an absolutely amazing initiative because the people that wear the shoes know exactly where it hurts the most. And you mentioned the fact that Nigeria has between 3 to 4 rheumatologists in the whole country. So this is a very good convergence.
They have 43.
43 in the whole country. That is still quite a low number compared to the needs out there. But because
out of that 43, most of them are in diaspora.
Wow, that is definitely
so we have less.
That is definitely one for the books. This is just the beginning of this conversation. It's a developing one. I'm sure after the conference, we'll touch base and look at some of the resolutions right after. Thank you so much. In very, very, very short words, in 60 seconds, I'd like for you to say a word of encouragement, of whatever comes to your heart for those living with lupus in Nigeria as we wrap up.
Yeah. This study made me understand when the word lupus warriors, and I would say that people living with lupus and with the experience I've had talking to people with lupus from Nigeria, they are really warriors because they have a lot to deal with besides that. So I want to tell everyone, keep your chin up, keep pushing, take it easy, find someone that you can speak to when it's heavy. Don't carry the load alone. If you have a social connection, a social group that you can go and pour out your mind, that is very important. Stick to your medications, and I know it's hard, but let's keep hope alive, and hopefully something will turn up. And that's my prayer, that's my hope for this conference. Don't give up. Just keep hope alive.
Thank you so much. Keep hope alive, and we're not giving up. Thank you so much. We will continue this conversation. Have a beautiful rest of the day.
Thank you very much. Thanks for having me.
You're very welcome. Afang soup is a beloved delicacy in many homes across southern Nigeria. But beyond its rich flavor, the leaf at the heart of the meal may offer several health benefits known as Afang or Okazi. The leafy vegetable is rich in dietary fiber, which supports digestion and helps maintain a healthy gut. Afang leaves are also packed with antioxidants, including vitamin C and beta-carotene, which helps protect the body cells from damage. They contain important minerals such as calcium, iron, magnesium, and zinc, nutrients that support healthy bones, blood functions, and immune functions. And unlike many leafy vegetables, Afang contains a notable amount of protein. So the next time you enjoy a bowl of Afang soup, remember, you're not just enjoying a traditional favorite, you're giving your body a nutritious boost. That's it for us today on the show. I hope you learned a thing or two about lupus. We have not ended this discussion. It is something that we're going to continue. Stay blessed and not stressed. I'm Ukeme Etukwa. Bye-bye.